I'd like to introduce Mary Naylor, the Director of the INQRI Program.
Good afternoon, all. I'm delighted to be joining you today. I'm Mary Naylor, and based at the University of Pennsylvania School of Nursing, speaking with you today on behalf of Lori Mellicar, the Senior Program Officer at the Robert Wood Johnson Foundation, Mark Hawley, a world-class healthcare economist, Heather Kelly, the INQRI Program Associate, and INQRI, the Interdisciplinary Nursing Quality Research Initiative, which is sponsored by the Robert Wood Johnson Foundation, is really thrilled to be sponsoring a series of webinars that are designed to help keep us all informed about advances in efforts to implement the IOM recommendations related to the future of nursing. I'm going to ask if everyone could put their phone on mute while the presenters are speaking, and we'll have then a chance to open it up for each of you to hopefully have time to speak with and talk and respond to some of the great pearls that you'll hear today. Today we're going to launch our webinar series with a focus on Recommendation 3, which is related to nurse residencies and their critical role in assuring that people receive the care, high-quality care that they deserve and delivered. And we're delighted to be joined by about 200 people on this webinar, a wide range of scholars and policymakers, healthcare leaders, clinicians, all of whom recognize the critical importance of nurse residency. And we're thrilled to have a series of presenters led by Charles Krozek, who is the Executive Director of the Versant Center for the Advancement of Nursing. For more than 3 decades, he has been devoted to improving the quality of patient care as a clinician, as a preceptor, mentor, educator, administrator, and entrepreneur. And I think what's really interesting as you hear a little bit about his background and those of colleagues who are joining him is to get a sense of how great ideas started. In 1999, while serving as Executive Director of Education and Research for Patient Care Services at Children's Hospital, Los Angeles, he led the creation of an outcome-based RN residency pilot. And this was designed specifically to support new graduates' transition into the workplace, get to better retention, get to better patient outcomes. About 5 years later, in 2004, he co-founded with Mary D. Hacker, Vice President and Chief Nursing Officer at Children's Hospital, Los Angeles, Versant Advantage, Incorporated. The mission now is to provide the RN residency to new graduates from hospitals across the nation. 5 years later, I don't know if that means anything, but in 2009, he and Michael Carman, who is Versant's Advantage Pro Bono Chairman and has been a mentor to this organization for a number of years, formed Versant Holdings in order to extend this concept of the nurse residency to the entire professional nursing organization and world. And as of December 2011, Versant has graduated more than 10,000 RN residents at 85 hospitals nationwide. In 2010, in part driven by what is now going on in our world in healthcare reform, Mr. Krozek and Mr. Carman co-founded the Versant Center for the Advancement of Nursing, or VCAN. And the mission of VCAN is to create and distribute thoughtful nursing leadership addressing the future nursing debate. Now, Mr. Krozek is working full-time on the Versant Center, using his professional experiences, his base as founder of this and leadership, and his passion to influence the national debate. We're really excited that Mr. Krozek is joined today by Michael Carman, who, in addition to being this unbelievable mentor, has been a business leader for more than 27 years, business executive, advisor in many worlds, including healthcare, pharmaceuticals, as well as aerospace and process industries. Additionally, Mr. Krozek is joined by Larissa Africa, who began her career at Children's Hospital in 1999, was in the very first cohort to participate in the RN residency program at the hospital, the model that would eventually become the Versant RN residency. In her current role as Chief Vice President, Chief Operating Officer, Ms. Africa leads Versant's Performance and Outcomes Management and Curriculum Development team, and we are thrilled to welcome Charles, Michael, and Larissa to the launch of our INQRI-sponsored series. Charles, now let me turn it over to you, and again, thank you for being part of this program.
Thank you very much, Mary, for those great introductions. And I'm very honored to be joined by my colleagues, Larissa and Michael, and really for the opportunity for us to be able to present the work of Versant and the RN residency program to all of you this morning. And I want to thank the Robert Wood Johnson Foundation and the Interdisciplinary Nursing Quality Research Initiative for this opportunity. In the interest of time, I'm going to be doing the main part of the presentation and presenting the material regarding the Versant residency program. And then we're going to have a Q&A period afterwards. And at that time, I'll be joined by my colleagues, Larissa and Michael, and we'll be able to take questions regarding the presentation or anything else that you would like to ask regarding the Versant RN residency program. The agenda today is really, it starts off dealing with the future of nursing, the Leading Change Advancing Health report, and the recommendations that were made from that. And specifically, we're going to be talking about RN residency programs. RN residency programs include those that are transition to practice, but also those that are transition to specialty. Both residencies are extremely important, especially in the acute care setting where Versant works primarily. After that, we're going to do a drill down into the Versant RN residency model and really give you a good idea of what it is, what are the components of it, and really the philosophy behind the Versant residency program and why we feel that it's been so successful over the years. Where it all started, basically, was the Affordable Care Act. This was the broadest healthcare reform since '65. But along with that, there's the implication of these new demands on healthcare system are pretty significant. So how could nursing respond to these demands in a way that we could be effective as leaders and partners in really making sure that these healthcare reform initiatives were done? Well, the Robert Wood Johnson Foundation approached the Institute of Medicine and created a partnership to be able to identify, assess nursing, and respond to the needs of the There was an 18-member committee, which their task was really to come up with a blueprint for action, and that's exactly what they did. That the IOM is really, it's based on facts, it's based on evidence, and it was extremely important that a body of work has been done on demonstrating the effectiveness and the support of residencies previous to this report, so that they are now being highlighted in that, and it's hugely important and have that ability to do that now. Now, the Future of Nursing report is really structured around 4 key messages, and underneath that, 8 recommendations. These 8 recommendations, if you look at them, really transition to practice residencies and transition to specialty residencies really address several, if not all, of these recommendations, anywhere between engaging in lifelong learning to diffuse collaborative improvement efforts. Really, number 7, prepare and enable nurses to lead change to advance health. So it's all about preparing, developing our nurses, our profession, as well as providing them opportunity to transition to new specialties and to basically be successful in various aspects of the healthcare system. We're going to focus primarily on recommendation number 3. So why a transition to practice residency? Well, first of all, we know that there is no way that our nursing schools are going to be able to prepare a nurse for a complex, rapidly changing healthcare environment. So there's this academic to service gap which does exist, and it will continue to exist because of this rapidly changing environment. Now, coupled with that is the need for effective transition to practice residencies, whether you're talking to the National Council, the Carnegie Study, Joint Commission, or a host of other researchers. The fact is that to bridge this gap between academic and service, to be able to transition this new graduate from the point of being to the point where they are a competent, safe practitioner is quite a leap, and it takes a lot of work. It takes and what we believe at Versant, it takes a very systemic, integrated, comprehensive program, very disciplined program to be able to effectively do that, and make sure that that nurse is ready to practice by the time they do enter independent practice within an organization. Because if they don't, this is going to be really a risk to the quality and safety that is for the patient, the hospitals, and the nurses working within that organization. So what is a residency? Probably you talk to 10 people, you get 10 different definitions. And that's kind of just where we are really in the evolution of residencies right now. But honing down, we do have our definition of a residency, which we think is very, very good and very applicable and very effective in how to articulate what is needed for residencies, and particularly in this case, the new graduate transitioning into practice. This one quote here comes from Sil Trepanier, who's the Senior Regional Director of Tenet Healthcare. He was did a webinar for the Versant Center for the Advancement of Nursing back in February. Wasn't too far back in February, that was this month. And the fact is that when he was asked this question during the Q&A period, what is a residency? These are the points that he made, that it's an extremely structured program, that it's a competency-based program, it's consistently implemented throughout the organization, and includes supportive components such as mentoring, debriefing, one-to-one precepting, and it really requires demonstration of those competencies. And this is an important point. It's during the residency. So the residency has to be structured in a way that the resident who is going through it has a set of competencies that have been identified that they need to be competent in. But it's that during that period of the residency that they are then go through a process by the end of that they have been evaluated to the point that they're 100% competent prior to moving into independent practice. And that's extremely important that we look at the fact that they are 100% competent prior to moving into independent practice. Because 95%, 90% is really not an acceptable amount at this point in time, because what 5% of the competencies are okay not to be competent in before they enter independent practice. So when you look at options out there, and we travel all over the country, and we talk to folks about what's being done with residency programs. Some organizations are still opting out for the traditional new grad orientation program. But the fact of the matter is that usually is characterized by skills and procedures and those being performed in the context of an organization. A residence itself is a much broader form, as was characterized by Sil Trepanier's quote just before, that they are disciplined, they are standardized, they are integrated systemic approaches into an organization. They're comprehensive, evidence-based, and outcome-based. So the other options that we see out there is people developing an internal residency, organizations taking the bull by the horn and developing their own program internally. As the definition for residencies has expanded, they have become much more complex. And the components of a program and the ability to manage those components, to measure outcomes, to the effectiveness of the residency has gotten pretty hard. So the amount of resources that go into managing a developed internal residency are quite significant. But some organizations that do have these resources available do a fantastic job out there doing residency programs, and we applaud them for doing that. Some of these folks that are doing their internal residencies use a third party, such as an LMS or a set of competencies that they have purchased from a third party individual vendor. Now, the point I want to make is that bringing in a set of competencies is only the tip of the iceberg, because with those competencies you have to develop, for a full-blown residency, you have to develop your curriculum around those competencies. You have to teach to those competencies, monitor to and evaluate to those competencies, and then the effectiveness of that residency on the organization as a whole. And that's really where Versant comes in. We have created a sort of this comprehensive systemic approach to residencies, and that's how we work with organizations. many of our clients, in fact, most of our clients are community-based hospitals that don't have the internal resources really to develop and maintain their own internal residency program, so that they use a third party such as us, not just for competencies, but for the entire program, that we work with them, integrate it, and help them manage that program and evaluate it over time. So the criteria for evaluating whether a residency is effective or not, one is, can you sustain the organizational development? The title of this program today is about organizational development. It's utilizing an onboarding transition program to develop your organization. In other words, it becomes much more than just moving that new nurse from the point of hire to the point where they're able to practice in a particular unit, but it spills over into the entire organization. So you're developing preceptors, mentors, facilitators, managers, subject matter experts, all at the same time in the context of a systemic framework of a residency program. And if you approach it that way, you not only are developing the resident, but you're developing all these other individuals in context with the framework of the residency, and thus you get a really big bang for your buck, and you end up developing an excellent nursing organization that could then be sustained over time. Now, coming from that, if you do have that organizational development in place, that you get consistent, safe, competent care. Now, this is the second point of evaluation. Do you get this? So can you sustain the organization development? And if you do, what are your outcomes? And we assume that they're going to be, and we have shown that it's really competent patient care. You improve the ability of the nurse to provide that care. And the third thing is investment justification. This is a tough one, especially in this economy, that the CFO certainly wants to see that Excel spreadsheet and make sure that anytime an investment is being made, that it has outcomes that are beneficial to the organization. But if you can get number 1 and 2 up there, you can get that organization developed and sustain that, you get safe, competent care. That third one of investment justification kind of falls out. If any folks have questions on that, please ask it during the Q&A period, and we'd be happy to elaborate on that. This part actually was covered by Mary. Thank you very much, doing a wonderful job on that. So I'm not going to repeat that. It's just the fact that we did go from a development-based program to a national program of 85 hospitals now. And it's been an incredible journey, and we're very proud of the work that Versant has done to do that. Now, take a look at this slide. This is what I was talking about, how you develop more than just the resident. So the 85 hospitals that we've had over this period of the last 12 years, that we have over 10,000 residency graduates. But along with those residency graduates, take a look at this. You got over 20,000 precepts have been trained to the Versant residency program. Over 4,000 subject matter experts. You have over 3,000 mentors. So this is truly involving and engaging the entire organization in the context of a residency that then allows not only the resident, but all these other individuals that are in the organization to continue to develop their lifelong learning skills and be involved in the organization. So the mission of Versant, one nurse at a time, we develop and sustain the professional nursing organization. And through that, we feel we can improve patient safety. Now, service offerings. This provides what Versant provides organizations, and this is our philosophy, is that if you can have a framework, a systemic program based on a residency philosophy that we utilize, you can transition your new graduates into the organization into specific units. You could onboard with this experienced nurses, and then once you have your experienced nurses in the organization, transition them between specialties. And what that provides you is the ability to have targeted organizational staffing, strategic staffing that provides the organization a degree of freedom by using the residency concept to staff where they need to staff, to develop their nurses to be where they need to be within the organization. And now more than ever, it's getting more complicated with, let's take peri-op, for example. The average age of nurses in peri-op is older than our average nurses nationwide. They're going to be leading the ORs, and we're going to be able to really have the ability to transition not only new graduates in the OR, but those folks that want to come from other areas of the hospital as well. So it provides you a degree of freedom to really strategically staff your organization. Okay, let's talk about our model here. I'm going to be running through this fairly quickly, but please feel free to jot down some questions in the chat room, and we can address those during the Q&A period. First of all, let's talk about the core of the residency. Now, the resident, comes from academic. Their BSN, ADN, diploma. The Versant RN residency program is equally effective for all these individuals. Now, once that person leaves the academic world, they move into service, and this is their first job, and they start off as novices. The first part of the residency is an 18-week immersion period, and this is a very comprehensive, highly choreographed, competency-driven piece where the resident has the competencies identified for them. They're taught to those competencies not only in the classroom but also at the clinical bedside, and as well as supported through the supportive components. So this first 18 weeks is extremely important, and at the end of those 18 weeks, the resident is to be 100% competent based on the evaluation of those core competencies that have been identified for their particular profile. Now, following that 18 weeks is an extended 34-week supportive component piece. Now, supportive components, and we'll talk about them in a little more detail in a little bit, but they're the mentorships and our debriefing groups. And these are extended out through that. So the total length of the Versant RN residency program is 1 year with an 18-week front-loaded immersion program. And then those folks do follow through in the organization and continue to develop themselves, and hopefully through the proficient and expert transitions. Okay? The comprehensive nature of what we offer our clients. First of all, it's the application-driven classroom instruction. So of those 18 weeks, again, we're talking about this 18-week immersion piece right now. There's about 200 hours of live interactive sessions. The person has developed over 200 modules that are based on the competencies. Remember, we start off with a set of competencies, and then we develop curriculum and teach to those. Now, the fourth bullet here talks about subject matter experts. Those are those individuals within the organizations doing the Versant RN residency program. They're identified, and then they teach the various modules. But there's a huge variation in the ability of these folks to be able to teach. Some are great, some are not so great, some have done it a lot, a few of them have not. Subject matter experts can be your nurses, your physicians, pharmacists, respiratory therapists, social workers, etc. To help reduce the variation in the process of teaching these live interactive sessions, Versant has created subject matter expert workshops. And so we have developed this curriculum, which is then provided to those organizations doing Versant to help train and stabilize the presentation of these materials. Subject matter experts learn how to interact with groups, to lead scenarios, as well as to engage the students, etc. Secondly is your clinical immersion period. 650 hours, one-to-one precepted immersion. These are based on the competencies that have been identified for that particular nurse who is going into a particular unit. Those precepted time is done on a home unit and what we call looping. Looping, or if, say, a home unit, which is that area which that resident is working towards working in, say they're hired into the ICU, so the 18 weeks immersion piece, they're going into the ICU. They will spend that time with their clinical practice there. Looping is associated departments and units that are associated with that home unit. So if they're going into the ICU, for example, that looping areas might be the cath lab, the ER, the OR, etc. Each one of those looping areas needs to have preceptors assigned and performance objectives for the resident. So it gets kind of complex here, but fortunately, Versant has an answer for that. The other piece is that these preceptors are also having to be. So We want to make sure that we reduce the variation in practices of preceptors as well. Now, you see the second bullet there says team preceptor model. In the interest of time, I'm not going to talk about that right now, but if there's some folks who want to have a little more information on that, please don't hesitate to ask during the Q&A period. The core competencies, those 219 competencies, are divided into three main categories. One is the core competencies. We have 21 of these, and these are those competencies every single nurse that comes in the organization, regardless of specialty, needs to be competent in. Okay? Then we have 47 multi-specialty competencies, and those apply to the RN residents. They're going into more than one specialty. And then there's 151 specialty competencies that are then that have been developed for these 7 main specialty areas. And the point being that new graduates can successfully transition into specialty areas. Anywhere from adult critical care, NICU, PICU, all the way down to perioperative. Now, perioperative is an interesting one because you talk to most people who have been involved with educating nurses that are in periop, that it takes more than 18 weeks. Well, we can bring them to a certain point in 18 weeks that they can actually work in one of the specialty areas. If they're going off to additional special areas, of course it takes a little more time. But we're very excited about our periop because of the fact that of our relationship and partnership with AORN, that the Versant RN residency program with a periop specialty exclusively uses periop 101 curriculum. And we're very honored and very excited to be working with Linda Groh and her team to integrate AORN's curriculum into the Versant RN residency program. Now let's talk about supportive components. We talked about the classroom activities, we talked about preceptorships, but let's talk about the mentor. The mentor is a non-evaluative individual. That their big role in working with that resident is to promote professional growth and development. Hugely important. They're different than the preceptor. They're out of the evaluative line, so this is a safe relationship. And they talk about topics about evidence practice, quality outcomes, many of these topics and issues of being a nurse, not just doing nursing, but being a nurse within an organization, which is hugely important role of a residency program. We do Versant mentor workshops, so we provide train-the-trainer materials so that mentors are continuously trained, and we have topics that have been developed over the years for that. Now, we do this one-to-one or with mentor circles, and again, mentor circles is really a unique, innovative way of doing mentorship, and that's, again, a longer discussion, but if you'd like to talk about that in Q&A, we'd certainly like to address that for you. And the second, the supportive component has to do with our debriefing self-care sessions. This is where the residents have an opportunity to share with their peers what they're experiencing and adjusting to the new role. Hugely important and beneficial, and decreasing the stress, especially that stress that is related to turnover. So these are facilitated by 2 folks that are trained within the Versant RN residency program. One is a group process person. This could be usually a social worker or someone from pastoral care, and also a experienced expert. So it could be a manager, educator, somebody who's been in the trenches. So those 2 people get together as a team, facilitate this group, and it's a wonderful experience where those new residents can talk about such topics as maintaining balance in their life, caring for a dying patient, those things that those of you that are nurses and look back on what your experiences was within that first year, it would have been very nice to have the opportunity to talk about those things. Now, system integration, very important. Without system integration, it's very difficult to have repeatability, consistency, and sustainability. Programs tend to fragment, and they have a lot of process variation. So some organizations have had success in partially integrating these components. As we talked about the options for RN residency programs, if you have the resources intact within your organization, you can bring these components together, put them around the resident. Now, the caution here is that again, this takes a lot of energy to put into the system to maintain its integrity over time. And what many times will happen is fragmentation occurs. And when the fragmentation occurs, that the mentorship part isn't working, the preceptorship isn't working as it should, et cetera, that there's a risk to the program not being effective and thus a risk to the safety and quality of the care that's being provided. Now, what we do here at Versant, and this is just to demonstrate visually on what we do, look at right at the top. It says Versant Outcomes. So we've come in and we've created a set of outcomes and a mechanism and process to be able to collect data that then reflects the effectiveness of the organization, of the residency within the organization, and provide that back. Also, just to the left of that, you see the Versant POM team. That's the Performance and Outcome Management team. These are the boots on the ground. These are the Versant consultants that work with the hospital to implement and manage over time the performance and outcome of the residency. And then the fourth gear down on the left-hand side is the Versant Voyager. That's our IT framework, which is essential to manage the complexity. We'll talk about that in just a couple minutes. How about that, huh? Let's talk about the evidence-based aspect of the Versant RN residency program. First of all, I would recommend, if you haven't read this article, to look this up. This is in the November-December 2010 edition of Nursing Economics. This is Versant's 10-year study, a longitudinal study of the outcomes and the effectiveness of the residency. This is over 10 years, and it demonstrates that we can improve retention, confidence, and competence of these new graduates. Extremely important. Versant, we've had a decade of experience, and really the trick here is the attention that we've paid to evidence over this time, which has provided us now with this body of evidence supporting RN residency programs, and being able to now take that and use that for influencing the healthcare community, our healthcare organizations, to implement these programs to help drive the development of our professional nurses. Now, the other part of evidence is really what's in the residency. So you've got evidence that supports the residency itself, but internally you've got all the curriculum. You've got all the classroom activities, and you've got the competencies. And these have to be built, developed, monitored, and enhanced consistently. And it's important that we integrated and incorporated the evidence-based safety mandates, recommendations, and best practices on a national level. What Versant does is does this for the organization. So we take care of all the curriculum. We utilize our internal curriculum folks as well as a host of expert consultants throughout the country that we constantly comb through, update, enhance, and then provide back to all of our clients the most up-to-date curriculum, competency-based curriculum that's used. And we, again, with our partnership with AORN, we also, our consultants are very much integrated with their own professional nursing organizations, which helps bring assurance that the curriculum is constantly evidence-based. Now let's talk about standards-driven. Why are standards important? Well, standards are important because, as the takeaway says at the bottom of the slide, they ensure integrity, consistency, replicability of results, and sustainability. Our standards fall under 4 key elements, which have to do with organizational leadership engagement, supportive organizational structures, using the Versant Voyager, the IT framework that manages the complexity. This is a standard. And then the evidence-based piece, the collection, management, and reporting of data that reflects the effectiveness of the residency. We have 11 key standards that are essential. These are the musts. And we have found over the past 12 years that these 11 standards, and we could talk more about those in detail during Q&A if you'd like, but these 11 standards are essential for the consistent implementation and sustainability of the residency over time. So we take a very disciplined approach in relationship to our standards. Okay? Outcome-driven. We measure a wide variety of outcome metrics. These are collected, evaluated, provided in a form that then can be returned to doing the Versant RN residency program, and then that data can be used for enhancing the program within the organization. As you can see, we collect anything from competency, confidence, satisfaction, group cohesion, quite a bit. Now, the key and the really difficult part is how do you collect all this information and manage it? Well, first of all, we had to identify when we were going to collect it. On the left there, you see the comparison group. And what is a comparison group? Every hospital we go into, we look back 2 years. And during those 2 years, we see what new graduates were hired. And we do various measurements on those new graduates that are still within the organization. We also ask for 12 and 24-month turnover of new graduates prior to us coming in. Then during the residency, collection points happen multiple times. 5 different times we collect the various tools and metrics, and then up to 60 months. So we follow the residents within your organization for 5 years, which provides us with a really nice picture and overview of how these residents develop within an organization. Okay, let's go over 3 of them right now. Again, we measure a lot of stuff, but I'm going to talk about 3 specific ones here. One has to do with the turnover reduction. That blue line on the top, the one that has 2 points, starts at 27% to 48%. These are the turnover, the pre-Versant new graduate turnover rates that were then reported to us for the past 12 years. And these are the average. So at 12 months, on an average, our hospitals lost 27% of their new graduates within the first 12 months, and then 48% within 24 months. Almost half of the new graduates that they brought into the organization, invested in, trained, they lost within 2 years. Now, with the Versant RN residency program, that's the maroon line below, you can see that we've reduced our turnover at 12 months to 7%. At 24 months, the cumulative is 19%. And you move right out there to 60 months or 5 years, the turnover is only at 39%. And really, as these individuals settle into the organization and are retained over time, not only to provide huge benefit for the organization's development of that organization, but also the turnover really reduces over time. Now, one might say that, well, the economy has influenced this dramatically. Well, we see some of that, yes. But even in the last 3 to 4 years, when we go into organizations, this turnover of the new graduates are significantly higher than that of the general nursing population within that organization. And when the Versant residency program is integrated, there's still a huge decrease in that. Now, what might be a very important point here is the fact that this turnover reduction really represents the number of nurses that are saved and those you don't have to hire. So if we're talking about investment justification, you reduce your turnover and you can save yourself 5 nurses a year. Each one of those nurses that you save, well, you can do the math. Is it $40,000, $50,000 for replacement costs for that nurse? Well, there you've got part of your investment justification. It doesn't take too many of those nurses to pay for a program such as this. The second metric that I want to talk about is the Slater Nurse Competency by Observer. Now, yes, the preceptor is using their competency checklist on the unit to evaluate the resident at the bedside. However, we take this one extra step, that the Slater Nurse Competency by Observer, what that is that observers are trained within the organization, these are nurses, on how to use this tool. Their inter-rater reliability is then created, and they go up and they observe these residents. We randomly choose these residents, and then they go up and they observe them for 2 hours and see how they do based on this tool. What is very interesting here is the ability, because of the immersion nature of that 18 weeks at the beginning of the residency, we can accelerate their nurse competency. That comparison group over there on the right of 262, that is an average of 17 months of tenure. We went back and took a look at the new graduates over the past 2 years prior to us coming in. We did Slater Nurse Competency observation on them. That was their score. But take a look at with the Versant residents, that after 18 weeks, their scores equate to the new graduates prior to at 17 months. So it's being able to accelerate the development of these folks, again, through a very disciplined, systemic approach to residencies. Now, competence drives self-confidence, and what we have found that with the residency, that there's this continuous improvement in the self-confidence of the resident over time. Again, we have this marker here from the comparison group, the pre-Versant aggregate at 17 months. So it doesn't take very long as that resident is going through the residency to go right past where those pre-Versant new graduates were at 17 months of experience. So anyway, driving safety by accelerating nurse self-confidence is a huge, huge benefit of this type of a residency program. Now, performance and outcome management. What holds all those together? Again, it's a very complex program, and what we have done, as we talked before, is that we have surrounded that with our boots on the ground. These are our nurse consultants that help implement and then manage the performance and outcome over time. So it's this partnership of Versant with the organization which makes that possible. They help with the implementation. They make sure that the Versant standards and best practices are implemented within the residency at the client organization. And they help take that data that is brought out of the program, again, through Voyager, all those metrics, and once those reports, the data is analyzed and reports are developed, then those are presented back to the organization so that they can be used for critical decision making. Then we have the Versant Voyager. This provides a disciplined web-based framework. You can't do the program without it. Just think, for example, if you have 20 residents going through a cohort, each one of those residents has 200 hours of classroom activities, 650 hours of clinical immersion. They're off to the various looping units where they also have to have preceptors and performance outcome measurements. And you have to train all the preceptors, residents, mentors, etc. So you see what I mean. It gets pretty complex. There's a lot of components here that need to be managed in a consistent way. And the IT framework of Voyager provides that ability to do that so you can sustain this program over time. And if you can sustain the program over time, then you can develop that organization to a level that has never been at. And that will get you the safe and consistent safe patient care. Now, VCAT. This is the Versant Competency Acquisition Tracking System. It's our competent-based management. This is the root of everything we do. This is the core of everything we do, the fabric, if you will, that you must have these competencies that have been defined, developed, and validated. Then you have to develop your curriculum around them, teach to them, demonstrate clinical performance based on them, and utilize standards to monitor and manage adherence to those. That's where Voyager comes in handy, and then you measure the outcomes based on that. So competencies drive, again, every aspect of our program for every resident, and again, one nurse at a time. So as we move into the discussion time, I just want to reemphasize that at Versant, this is what we believe, that an immersion-based, comprehensive, systems-oriented residency approach to onboarding and transitioning both the new and the experienced RN within your organization, such as Versant, it really provides tremendous organizational development for all of our clients, better outcomes for our patients, and good business for our hospitals. So, at this point, we want to go into the Q&A section, and I really posed the question to you, how do we do? Are we presenting a program in a way that can sustain organizational development? We feel we do, and we think we're doing pretty darn good. And from that, consistent, safe, competent care is being provided. And then the investment justification does fall right out of that if you get those first three done. So at this point, I'd like to welcome my two colleagues, Michael Carman and Larissa Africa, to join me with the Q&A period here in the discussion regarding the Versant residency program and residencies in general. And so, Heather, could I pass the microphone back to you?
Thank you so much, Charles. I'm going to unmute all of the lines so that people can submit their questions. So you'll just hear that echo on your phone for a second as you're unmuted. And then we've also had a couple that have come in on the chat feature, so I'll have those for you as well.
Excellent.
I'm going to go ahead and read to you, Charles, one of the questions that has come in. Actually, we had two questions that were focused on some of the specialty training, asking if there were any specific training available for programs related to care transitions or home care, and then also another person submitted asking if there were any related to community or public health.
The residency, the model of the residency that we have developed for inpatient, for transition to practice, and for transition to specialty, I think can be translated and used for specialty care, home care, etc. We're currently are not working in those areas right now, but certainly there's been a tremendous amount of discussion in the community on the need to have these transition specialty residencies for home care and community health. Mike and Larissa, do you have?
Yes, if I may add to that, Charlie is correct that right now we're focused on the acute care setting in both pediatric facilities and also general acute care hospitals. We've also received some inquiries regarding home care community-based settings and also even some outpatient ambulatory care. These are conversations that we are entertaining. It's definitely a different type of curriculum and competencies that are needed, and there's still a lot of things that we need to learn at this time. But I think as the healthcare reform continues to be implemented, it's something that certainly is in our radar, very much so.
Next question.
Are there any programs related to primary care in rural settings? Was it
In terms of the primary care and rural setting, we're in the same place as the home care community base. Again, we've had some initial discussions with some groups who are providing primary care, but at this time, it's not part of our service offerings. But we'll entertain any discussions that folks may be interested in having with us and looking at how to develop nursing residency, including all of the support system that it comes with for those nurses in there.
You know, if I might, we clearly recognize that that's a direction that we as an organization need to move into. We clearly recognize that that is a part of the market that is vastly underserved today. One of the steps we've been taking, however, in an obstacle to approaching these areas is how to develop and disseminate and teach a curriculum when, by definition, you have smaller numbers, far many more sites than you would have in a typical acute care setting. So one of our major initiatives is a rework of our curriculum to make that curriculum one where we can increase the amount of interactivity, if you will, of that curriculum in a way that it becomes more amenable to a distributed delivery system that we currently have. That's in the works. It's important to us as well. We're not at all blind to the issue that the fact that we serve one element of our market very well doesn't mean that we don't have to evolve into other areas. So that's certainly in our plan.
Good. The program seems to focus on the new graduate, says one responder. Have you seen facilities apply your model to nurses who are re-entering the profession after time away?
That's actually a very good question because right at the moment I'm in one of our client organizations and we are in the middle of piloting what we're calling a transition RN residency. The transition RN residency is not necessarily focused on re-entry nurses, but those nurses who are coming from one specialty, for example, a med-surg in one hospital, and then going into a new organization and transitioning into critical care. It also looks at nurses who are transitioning between specialties. So somebody who's been in med-surg for a number of years and now want to work in the emergency department. We're applying the same process and structures and standards that we are for the new graduate nurses to this transition specialty. So we are very excited that we are piloting this program as we speak.
You know, one of the important elements there as well, and you'll hear my comments more related to the development of our service offerings. One of the important areas there is utilizing and developing very strong objective performance gap analysis tools. One of the issues of whether you're onboarding or transitioning anybody at any level during their career is just what is their level of competency-based proficiency, and can that be demonstrated, and do we have a way of measuring that? So one of the tools that we're working on is exactly that, is to build objective assessment tools that will allow for us to customize in a far greater fashion than built today, if you will, gap remediation capabilities for the benefit of our clients.
That actually leads pretty well to one of the other questions. Someone asked, are there similar programs specifically for advanced practice nurses?
Go ahead, Charlie.
Yeah, one of the actually recommendation number one has to do with nurses being able to work at the scope, the broad scope of their license. Many states have different approaches to this on their regulatory requirements. But if we're going to move into actually being able to address the healthcare reform that we're going to have to be able to have residencies for these advanced practice nurses, especially in areas of primary care, et cetera. There are a few going on, and I can actually be able to identify one, and I can notify Heather of that, where some work is being done with advanced practice nurse residencies. We're currently not doing it within Versant. But again, those things are on radar screens for the future, definitely.
Another person has submitted a question asking if you could talk a little bit more about the 11 standards that you mentioned.
I can take that, Charlie and Mike, and if you can add to it as I go along. One of the things that we have found is there are certain measures and standards of practice that we have found to be a requirement in order to have the positive outcomes we found from the residency. And it really is about having organizational leadership and engagement from your nursing leaders in your organization to your chief nursing officer to your CEO. It's really important that all of those folks are engaged because their responsiveness to new initiatives trickle down to the rest of the organization. We, as an organization, our main goal is to help all of our clients down to the detail of providing support on how to structure and support an implementation of a residency. There's a period of time that we're there every 2 weeks to make sure that the residency is being implemented to the residency standard. There's also different roles within the residency that are required and as a standard of practice and have proven to support the success of our program. There's different structures as well that we have included as part of our standard and measuring our outcomes based on how the organization are able to support those different things.
So, Larissa, if I might add to that as well, that, one of the issues, we very recently redid all of our standards based on quite a few years of experience and really to focus based on that experience and based on the evidence that we've collected over the years about what really matters, what are the really important standards that allow you to define and, frankly, control the program. You hear us speak a great deal about systems and the role that a disciplined integrated system plays in delivering the results. The standards are absolutely critical to managing that process and that system in a way that result can be sustainable and repeatable, and you can, in fact, tie it back to standards, back to the outcomes that we seek and that we demonstrate.
Another question has just come in. It says, how do you approach measurement of competencies such as clinical judgment, critical thinking, or clinical reasoning in a concrete, objective way?
The critical thinking and clinical reasoning are actually integrated throughout all of the different pieces of the residency. We don't just have a class in critical thinking and critical reasoning. Everything is embedded in our curriculum. There's pieces. Every single module has critical thinking activities in it, down to our competencies. Our competencies are divided into subcategories where we look at everything from safety to quality to critical thinking and the new grad's ability to critically think through the whole process. The mentoring and debriefing as well, all of those, the critical thinking and reasoning are all embedded within the residency.
Very good. Very good. Well, I think there is one last question that has come in, and it says, in regards to the subject matter experts, how are they identified and recruited? Is that by Versant, or do the respective organizations recruit those experts?
Very good question. The subject matter experts are household employees, and what we do is help the organization not only recruit these subject matter experts, but also help with their ability and also with their experience in teaching the module. So depending on what the curriculum is, we encourage the organization to find the experts in those modules. For example, a class of medication administration, what we may suggest to an organization is to find somebody, a nurse, and co-present that information with a pharmacist, so it complements and looks at the whole process. So yes, in short, the organization's employees are the subject matter experts.
Wonderful, wonderful. Oh, another one just came in. How can I get further information on the mentor workshop?
You can definitely send me an email. We do have some information on our website, which is www.versant.org. But I can also be contacted. And Heather, can I give you my email address that you can also put it in the chat function?
Yes.
And it's lafrica@versant.org.
Very good. There was also another one that I missed that asked what are the costs of the services?
What we do is that we charge a license fee of $5,250 per nurse, and we justify that using ROI investment. There are certificate discounts available based on volume going forward, but it's done on a license fee per nurse for the program.
Very good. Thank you. Okay, I'm just going through to make sure I caught them all. There was a question that came in earlier, but I think you may have answered it in another one, just asking if there was a clarification question, if there's a difference between the acute care training and the critical care training. And it sounds like, Larissa, from something else you said, that there is something, especially for transitioning between.
Right. For the critical care nurses, there are pieces that are core to all new graduates who are coming into the organization. And then depending on which specialty these new grads are going into, we do have some specialty-specific curriculum and competencies that these new grads need to be validated on in the clinical area. So there are differences between each specialty. And we offer specialty content and competencies for areas of critical care, for perinatal, perioperative, neonatal, ICU, emergency department, and pediatric emergency.
Very good. Very good. If there are any other questions, please let us know. It looks like we've hit our time. So since we're right there at 1 o'clock, if you do have additional questions, my email address is up there as well as Larissa's, so please go ahead and submit them to us, and we will get them routed to the right person. But now that we are at the 1 o'clock mark, I would like to thank all of you for joining us today, and to especially thank our three wonderful speakers for joining us and providing this wonderful presentation. As Mary said back at the beginning, this is the first of several of a series that we're planning of each of the 8 recommendations from the IOM report, and more information will be made available as they are scheduled. The next one is schedule already, though, and I had information up about that at the beginning, but we'll make sure to get that out to everyone again as well. So you'll be seeing an invitation to joining that session. Thank you so much. And again, if you have any questions, let us know. Charles, Michael, and Larissa, thank you. Thank you so much.